Hey class, this is Dr. Ang coming to you to offer a quick overview of informed consent and the nurse's responsibility in this very critical process. There are both ethical and legal implications to informed consent, so please review the PowerPoint thoroughly. I have questions that I have embedded into that PowerPoint along with the correct responses. So if there are any of those that you don't fully understand, please reach out to me regarding those. But I do want to give an overview of informed consent. Along with informed consent, we also want to look at, there is also assent, consent, and desent, and we're going to peel these back and take a deeper dive and see what exactly these mean and the implications for you as a registered nurse and what that will entail for each of those topics. So basically, let me give you a little bit of basis behind informed consent. It was in 1914 when Justice Cardozo implemented informed consent, and that was based on the threat of the autonomy, which is the underlying ethical principle of informed consent. That is when autonomy was being jeopardized in the case of patients not being fully aware of what procedures and medical treatments were being placed. And autonomy is basically saying I have the right to choose what I feel is in the best interest for myself, and I'm the best person to say that. So autonomy, and along with that, kind of coupled with that, is justice for all. So what sometimes happens is there is kind of a collision between what a provider feels is best for the patient and then what a patient feels for himself or herself would be ideal or have the greatest benefit or greatest reward. So in healthcare, there are obviously different aspects or categories of which we could harm a patient without intending to do so. So we want to protect patient rights in every case as much as possible, but knowing there is risk for harm. In those areas of harm, it can be physical, which is a little more easy to detect. It can be physical, it can be emotional, which can be just a perceived threat of I think they were talking about me. I feel like that he or she implied this to me. There can be an early onset of kind of the on-ramp to full-fledged psychological harm that can be prolonged emotional harm, and it can get to the point where it's a permanently psychological harm that has been implemented that's going to take a lot more treatment to be able to reverse, if at all possible. Sometimes emotional harm can go on so long that there can be perceived permanent damage from that. There's also financial harm. If I coerce you into something, take advantage of someone financially, or present something to have greater benefit than what it actually does, that can lead to financial harm, as well as there can be, in the case of social media now as well as verbal, there can be reputational harm. You can harm someone's reputation to the point that they are no longer effective in a certain role, and which then leads to that emotional and psychological harm. So there's those four aspects that we definitely want to keep in mind, keep those on our radar as we are processing through and trying to avoid harm to our patient, protecting our patient from harm, doing good, beneficence, non-maleficence, avoiding harm. These are all ethical principles through which the lenses we need to look when we are dissecting the concept of informed consent. So, assent. Assent is, we view informed consent starting with a competent 18-year-old. that is capable of receiving information, processing that, and making an informed decision regarding their health care. Assent, on the other hand, are typically viewed as younger individuals that are not quite to the point where they can offer full informed consent, but they do have an opinion, and a very strong opinion. So you view a adolescent, for say, if they are being asked to participate in a research study, they may or may not want to do that. And it's important, along with that parental informed consent, that of a certain age, and it's usually around adolescence, can dip down. I have seen it as low as maybe 8 to 10 range, but typically you're thinking that adolescent age, that they're not quite to the point of 18 where they can officially give their own informed consent, but they definitely have an opinion. So you would ask for obtain assent from a younger individual. Then informed consent, again, is typically 18 years old. There are some exceptions that are detailed in the PowerPoint, and I'll touch on as well. But informed consent that is usually a competent 18-year-old, with the exception of some adolescents if there is seeking HIV/AIDS, typically sexually transmitted diseases, some in that case. If it's an abortion, that gets into some gray areas as well. And then alcohol, drug abuse treatment, those are getting into some gray areas where there can be informed consent younger. Also, for exantiated minor can offer, if they do not have any ties to an official caregiver, they can speak on informed consent for themselves as well. And then there's dissent, and that is where you say, I hear what you're saying, I see the evidence that's presented to me, this is what my healthcare provider feels is in my best interest and the interest for my diagnosis, and I still want to pull away and walk away. I realize the information that's been presented to me, and I do not care to accept that. And this can also be in the case again with research. I realize that this study is available. I've heard the pros and the cons, the benefits, the perceived risks and benefits, and I know the uncertainties, and I choose to walk away from this research study. That is also falling into dissent. And it's just, I look at that more. Dissent is a declining the offer. Assent with the A is accepting of the healthcare treatment or research participation. So again, informed consent, and that was based off, again, a case in around 1914. That's when that was implemented for the primary purpose of protecting the autonomy of the patient. So what is the role of the nurse in obtaining informed consent? This is critical. The role of the nurse is to witness and be a patient advocate, to make certain that that patient has received the full onset, the details in an appropriate developmental level for that individual and in their primary language. So it's the role of the nurse to say, hey, I care for this patient on a daily basis, and their primary language is Spanish, and you're giving this in English, and sure, they know some English, but they need to receive the information via interpreter. That would be your role as a nurse, to help advocate for that patient. But primary role is to witness, to be a witness to ensure that that patient received that information in an appropriate manner, that they can understand, comprehend, and make an informed decision for their health care. So in a case where a patient says to you, you've witnessed it, they have received some information on a procedure, they have received, another important part of informed consent is they have received alternatives. there are some sticky lines that can be crossed when there's a little under the table things regarding pharmaceutical, or if it's procedure wise, sometimes you can pass someone and refer someone for a procedure that is that in their best interest, or does that in some way offer kickbacks to the healthcare provider that made that referral. So there's also some sticky areas that we want to steer clear of that have legal implications and ethical concerns for sure. They go hand in hand. So knowing the alternatives, the patient should be fully aware of what the recommendation is, but also viable alternatives. And one of those alternatives will always be to deny what's being offered. They may choose to do nothing, and that is their right as a patient. If we are supporting the legal and ethical principle of autonomy, if they choose to do nothing, that is also their right if they are competent to make that decision. Also part of the consent, informed consent, very critical, they need to know the risks and they need to know the benefits, and they need to be able to weigh those and process those appropriately for their self. They may choose to get family, friends, whoever involved to help them make that decision, but ultimately it is the right of the patient, not of the healthcare provider, not of the family members that call in and give their thoughts and opinions. It is the right of the patient via autonomy. Then they also need to know the uncertainties. If it's a research study, we do not know fully. This has not been tested fully. That's why this is a pilot study. We are wanting to see the effects of this medication. So patients will know that they are entering into a study or a procedure where there are some uncertainties, and they need to be aware of that as well. So risks, benefits, and uncertainties. So again, and recap, what constitutes informed consent being implemented correctly? The patient needs to be aware of the procedure that is being offered or being recommended. And they also need to know the alternatives, viable alternatives. Then finally, they need to know the risks, benefits, and uncertainties of the procedures that are being explained and presented to the patient. Then given ample time to ask questions. This is not something that's done on the fly. This is done where there is ample time. And again, I want to reiterate that in the primary language and at a developmental level appropriate for that patient. So that is the elements of informed consent. If you look on your PowerPoint, I want you to take note that there are several times of which consent will be, let me pull that up really quickly. So there is, when you bring in the provider that's going to offer the procedure, and then you'll have the nurse as the witness, and then the patient, and then any support personnel that they want to have in, whether that's family or friends, that is going to be in the form of written consent. There can be oral consent in the case of a surrogate or whoever is appointed for that patient. There can be a oral consent if there's distance, logistics come into play. All of that would be in advanced directives. It would be clearly written out, and that would be the case with a collaborative effort for oral informed consent. Then there's also implied, and this one's important to note. If a patient suffers an injury, like a work-related injury, and is brought unconscious into the emergency center or department, there is going to be a life-saving measures implemented. That is when anyone comes into an emergency center initially, the way they're going to be met and received is any life-saving actions that we can implement, we are going to do so. There will be an implied consent to save that human life. That is the approach that will be, unless there are, if it's a DNR that's clearly stated, unless there's legal documentation contrary to that, there will be an implied consent to treat that individual without an informed consent. They are not able to competently give their informed consent, so that would be implied, and thus the procedure or life-saving measure would be implemented at that point, and it would be protected underneath what constitutes as an implied informed consent. So again, that was a very quick recap. Your fellow students that did the Know Your Rights poster for the community high school event did a fabulous job. So hopefully you got to see that, because they recapped everything beautifully on that. And knowing that you cannot cross lines, or you will be held legally responsible, and there will be legality that will be implemented for you as a nurse if you choose not to advocate for the patient. Patient advocacy is always our top priority. So whatever lenses that is looking through, we're always looking through patient advocacy lenses. If they don't fully comprehend, we need to fight for that. If they are about ready to go for a procedure and a patient looks at you and says, I don't fully understand why I'm doing this, knowing the risks that are involved, I was thinking, what about if I did this, or what if I avoided it until this, or I think I want to get someone to explain this more. I think I need to call someone else, because I really don't know why I'm doing this procedure, and I'm really scared of this procedure. In that case, the nurse needs to adventitiously advocate for that patient and find out what questions they have, and immediately call to that provider, surgeon, whatever the case may be for that patient, and put the brakes, hard brakes on that procedure until, and a lot of times the provider's not going to like this, but if you have to make that call and say they still have questions, that was not a proper, competent, informed consent procedure, because they still have questions. And maybe the provider did give a thorough explanation, but the patient in that moment can only take spoonfuls. They can't take the whole meal at that point. So sometimes it needs to be broken down a little bit for them to fully understand and make that decision. Even if they do give written consent for a procedure, and it comes down to time for that procedure, and they choose to dissent from that, you again would advocate for that patient, and you would notify the provider that they want to pull back and pull off of that procedure, and again advocating on their behalf. So that is important. Another aspect, not just procedures and thinking in the surgical aspect, which a lot of times it tends to be, it can also be for medications and different, used to be more so with restraints, different things. Now that tends to be more in line with medication treatments to control behavior. But let me give you an example, and I do have, again, in the PowerPoint, I have posed several questions, several case studies. Go through those, and if they make sense to you, you're golden for this content. If they don't, please reach out to me. But I want to give you another case and kind of give you the ethical background or backdrop, if you will, for why informed consent is so critical. Oftentimes we see this from my legal nurse consulting perspective. A lot of times we often see this in the case of mental health patients, where there is a perceived risk for harming either themselves or someone else. So if a patient has been very clear that they do not want a certain medication, it makes them feel very, although it can calm them down where now they feel they're mentally in a better space, more mindful, it maybe will exasperate horrific hallucinations or dreams to the point a patient does not want to be on a certain medication, and they have made that very clear. Then they come in to are checked in for one reason or another to a mental health facility due to some concerns or risks, and a provider may feel that they want to give them a medication just to control their behavior while they are in the facility. This can be perceived as an ethical dilemma. If you know that patient has stated they don't like the way that medication makes them feel, they don't like the responses that and side effects that come along with that medication, they do not want to be administered that medication. But then you're in the middle of, you know that's been stated, but you also have the provider that's saying, but we want to make sure the patient is safe and everyone is safe around them. So we want to make sure that their behavior does not escalate while they are in this facility, where then we would have other things we need to deal with. So we want to make sure that that patient is contained, not restrained, because we all know that is a hot buzzword. We don't want to restrain, but we want to safely contain, which also has legal ramifications if it's without the patient's consent. So critical nature, that then you would also advocate for that patient, the patient's wishes. And you get into that, though, ethical dilemma of, yeah, you do want to make sure the patient is safe. You want to make sure everyone is safe within this facility, or if it's at home, if it's wherever, you want to make sure that that patient is safe. Patient safety is key. But you also want to offer the perspective of the patient and the information that has been shared, and protecting the autonomy of that patient. You want to be respectful of the ethical principle of beneficence. You want to do good as a healthcare provider, as a nurse. You want to be respectful of the ethical principle of non-maleficence. You want to avoid harm to that patient. So how do I do good, and how do I still prevent harm, protecting that patient and their wishes, plus also wanting to protect the safety of that patient and the other patients and staff that are around them if it's perceived that their behavior might escalate. So that's an ethical dilemma that you might find yourself in, that when that patient is in sound mind and competent and capable of making an informed decision for themselves, and you may want to pull in family members if they have that, any support system where you can make that case. And if it's an informed consent that's been shared, yes, it gives you hallucinations, you have horrific dreams, but at certain times in your care, we may deem this as safe for you, and you may be in a position where you won't fully understand that. Would it be okay in those cases to administer this medication as a last resort? Would we have your informed consent for that? The conflict and the legal concern that surrounds this case would be, is it ever okay to coerce a patient into a certain decision? And the answer is no. Is it ever okay to crush a medication and put it into their pudding, as you would for a child, to try to disguise the constraint? And no, that is not okay. And that is actually any procedure or even administering of a medication, anything that you do or administer whether it's a procedure or medication, that you administer without informed consent from that patient, unless it's in one of those special categories of implied consent under an emergency situation, anything that you do against the consent of an individual can fall into the categories of assault, and even in some cases of full-on restraints into the category of battery. But it's typically falls into the legal ramification, and there was a threat or an assault. So informed consent is a very, very big deal for nurses, because we find ourselves on the front lines. We're in the front lines fighting for these patients. We also want to serve as their primary advocate. So we want to protect their autonomy as an individual patient that has very diverse views that maybe even are from ourselves. And that's where it gets in a little ethical rub if they are requesting, assenting, consenting, or dissenting to something that is contrary to what we feel is best. And you have to look at the situation of, does the end justify the means? Is it, in your mind, ethically okay if they potentially could harm themselves or someone else? So therefore, I'm okay, and I can justify in my mind of why this medication needs to be administered against their will. Were they really at a threat to harm themselves or someone else? Was their behavior actually escalating, or was it more for convenience of the staff? I'm posing several ethical dilemmas that I hope are giving you an ethical rub that you're forced to kind of sort through and peel back the onion of all your personal values and professional values of how you would respond in some of these circumstances, knowing that patient advocacy is key, knowing the autonomy of the patient is critical, knowing non-maleficence and beneficence are absolutely critical of doing good for that patient and not harming that patient. All these ethical principles come together in addition to justice for all. I need to fight and be an advocate for this patient the same as I do for the other 5 that I'm caring for. And I need to look at through a clear set of lenses, non-judgmental set of lenses. I need to look at what's best for that patient and what they want and what they either verbalize or have written in their legal documentation and representation. And I need to advocate. I need to fight for the rights of those patients. So that is informed consent in a nutshell. Again, the other students that did Know Your Rights poster, I hope that you will step up and offer some resources. If you have further things, you can come on and offer an announcement, or give your backup and your feedback of things that you found in your research, because that was spot on what you brought to the health fair. So anything I can do to help clarify assent, consent, dissent, who has rights, and surreptitiously, are we ever okay or legally protected if we surreptitiously do administer or encourage a procedure or coerce in any way? Is that ever okay to withhold information from a patient, to encourage them, coerce them to do something because we feel it's in their best interest when they clearly don't want that? So peel this onion back. Let yourself get a little uncomfortable and dive into the ethical and legal principles that surround informed consent and patient rights. Have a great day, and reach out if I can do anything for you.